1. What is the first step in the nursing process for making clinical judgments? A. Assessment. B. Diagnosis. C. Planning. D. Evaluation. Answer: A. Assessment. Rationale: the first step in the nursing process is assessment, where the nurse collects and analyzes patient data. This allows for informed decision-making in subsequent steps such as diagnosis and planning. The other options are steps that follow assessment. 2. In prioritizing patient care, which of the following factors should be considered first? A. Patient's emotional state. B. Immediate life-threatening conditions. C. Family requests. D. Patient preferences. Answer: B. Immediate life-threatening conditions. Rationale: the priority in nursing care is to address life-threatening conditions first, according to Maslow's hierarchy of needs. Emotional state, family requests, and patient preferences are important, but are secondary to immediate physical needs. 3. A nurse is preparing to administer a medication. What is the most critical step in ensuring patient safety? A. Checking the medication label for the correct drug. B. Asking the patient for their name and date of birth. C. Verifying the medication order with a pharmacist. D. Performing a patient assessment before medication administration. Answer: B. Asking the patient for their name and date of birth. Rationale: the most critical step in ensuring patient safety is verifying the patient's identity using at least 2 identifiers, name, date of birth, before administering any medication. This helps prevent medication errors. 4. When making clinical judgments about a patient's care plan, what is the nurse's primary role in collaboration with the healthcare team? A. To make final decisions regarding treatment. B. To delegate all responsibilities to the physician. C. To gather data and communicate concerns to the team. D. To ensure patients follow the care plan without question. Answer: C. To gather data and communicate concerns to the team. Rationale: the nurse's primary role in the collaborative team is to collect patient data, assess the patient's condition, and communicate any concerns or changes to the team for shared decision-making. Nurses do not make final treatment decisions independently. 5. A nurse is faced with an ethical dilemma where a patient's family insists on continuing aggressive treatment despite the patient's wishes to stop. What is the nurse's best course of action? A. Follow the family's wishes. B. Respect the patient's wishes and advocate for them. C. Call the physician to make the decision. D. Disregard both the patient's and family's wishes and follow hospital policy. Answer: B. Respect the patient's wishes and advocate for them. Rationale: the nurse must advocate for the patient's autonomy and wishes. Ethical principles like autonomy and beneficence guide nursing practice, meaning the nurse should respect the patient's right to make decisions about their care. Following the family's wishes could violate the patient's autonomy. 6. When assessing a patient's pain level, which method is considered most effective? A. Asking the patient to rate their pain on a scale of 0 to 10. B. Observing the patient's facial expressions. C. Reviewing the patient's medical history. D. Checking vital signs only. Answer: A. Asking the patient to rate their pain on a scale of 0 to 10. Rationale: the most effective and accurate way to assess pain is by asking the patient to rate it on a standardized scale, such as the 0 to 10 pain scale, as it allows the patient to express their experience directly. Observations and vital signs are supplementary. 7. What is the most appropriate action when a nurse notices a sudden decline in a patient's respiratory rate and oxygen saturation? A. Wait and reassess in an hour. B. Administer supplemental oxygen and notify the healthcare provider. C. Change the patient's position and monitor vital signs. D. Document the change and wait for the healthcare provider's orders. Answer: B. Administer supplemental oxygen and notify the healthcare provider. Rationale: a sudden decline in respiratory rate and oxygen saturation indicates a potential emergency. Administering supplemental oxygen immediately and notifying the healthcare provider is crucial for patient safety. Waiting or just documenting could worsen the situation. 8. Which of the following is the most important consideration when prioritizing care for multiple patients? A. The patient's age. B. the potential for harm or deterioration. C. The time since the last assessment. D. The patient's desire for comfort. Answer: B. The potential for harm or deterioration. Rationale. The primary consideration when prioritizing care is assessing the risk of harm or deterioration, as life-threatening conditions take precedence. Age and comfort are important, but are secondary to critical needs. 9. A nurse is about to administer a blood transfusion to a patient. Which of the following actions should the nurse take first? A. Ensure the patient's vital signs are stable. B. Verify the blood type and cross-match with the patient's records. C. Hang the blood bag and start the transfusion. D. Educate the patient about potential transfusion reactions. Answer: B. Verify the blood type and cross-match with the patient's records. Rationale. Verifying the blood type and cross-match before administering a transfusion is the most important step to prevent transfusion reactions and ensure patient safety. The nurse should also perform other tasks like checking vitals and educating the patient, but verification comes first. 10. A patient is refusing medication that is crucial for their treatment. What should the nurse do next? A. Administer the medication forcefully. B. Explain the consequences of refusing medication. C. Document the refusal and do nothing. D. Notify the physician and ask for an alternative treatment. Answer: B. Explain the consequences of refusing medication. Rationale. It is essential for the nurse to engage the patient in understanding the reasons for the medication and the consequences of refusal. The nurse should never force medication but should educate the patient to make an informed decision. Documenting the refusal and involving the physician for alternatives may follow, but education is the first step. 11. Which of the following is the most important factor when determining the appropriate care plan for a patient? A. The patient's age. B. The patient's diagnosis and medical history. C. The patient's social media presence. D. The patient's family history. Answer: B. The patient's diagnosis and medical history. Rationale. The care plan should be based primarily on the patient's diagnosis and medical history to address their specific health needs and concerns. Age and family history are factors, but the diagnosis and medical history should guide decision-making. 12. A nurse is caring for a patient who is receiving a blood transfusion. What is the most important observation during the first 15 minutes of the transfusion? A. Monitoring vital signs every 5 minutes. B. Observing for signs of an allergic reaction. C. Giving the patient fluids to help with circulation. D. Ensuring the blood is being transfused at the correct rate. Answer: B. Observing for signs of an allergic reaction. Rationale. During the first 15 minutes of a blood transfusion, the nurse should closely monitor for any signs of a transfusion reaction, which can occur early. Vital signs should be checked, but reaction signs are more critical in the initial period. 13. Which of the following is an example of a nursing intervention that promotes patient safety? A. Assigning care based on a patient's diagnosis alone. B. Using a two-person team to transport a patient with mobility issues. C. Ignoring minor side effects of a medication to focus on more serious ones. D. Not involving the patient in their care decisions. Answer: B. Using a two-person team to transport a patient with mobility issues. Rationale. Using a two-person team for patient transport helps ensure safety, especially for those with mobility issues, reducing the risk of injury. Patient involvement and addressing side effects are also part of safety, but not the correct response here. 14. What is the primary purpose of critical thinking in nursing practice? A. To avoid mistakes in patient care. B. To ensure patients follow the prescribed treatment. C. To make informed decisions based on evidence and patient needs. D. To question the physician's decisions. Answer: C. To make informed decisions based on evidence and patient needs. Rationale. Critical thinking in nursing helps nurses make informed decisions by analyzing data, considering evidence, and evaluating patient needs. It is not just about avoiding mistakes, but actively improving care quality. 15. Which of the following is an example of a legal consideration in clinical decision-making? A. Communicating with a healthcare team in a timely manner. B. Providing care without obtaining informed consent. C. Maintaining a professional relationship with patients. D. Ensuring the patient has adequate nutrition. Answer. B. Providing care without obtaining informed consent. Rationale. Providing care without informed consent is a legal violation and a major ethical issue. It is crucial to obtain informed consent before any procedure to ensure patients' rights are protected. 16. Which of the following actions would most likely improve the quality of clinical judgment in nursing? A. Relying solely on clinical guidelines. B. Engaging in continuous education and reflection. C. Ignoring patient preferences for treatment. D. Following physician orders without question. Answer. B. Engaging in continuous education and reflection. Rationale. Continuous education and reflection enhance clinical judgment by keeping nurses updated with new evidence and improving critical thinking. Relying only on guidelines or following orders without reflection can limit effective decision-making. 17. What should be the nurse's priority when caring for a patient with chest pain? A. Assure the patient that it's likely indigestion. B. Assess the severity of the pain and obtain a thorough history. C. Administer a pain reliever immediately. D. Call the physician before assessing the patient. Answer. B. Assess the severity of the pain and obtain a thorough history. Rationale. The priority is to assess the patient's pain and gather information to understand its cause, which could indicate a serious condition like a heart attack. Administering medication should be secondary to a thorough assessment. 18. When a nurse is unsure about a medication dosage, what is the appropriate action? A. Administer the medication at the prescribed dose anyway. B. Ask the physician for clarification before administration. C. Check the medication reference book and proceed. D. Consult with the pharmacist and document the concern. Answer. B. Ask the physician for clarification before administration. Rationale. When uncertain about a dosage, the nurse should always confirm with the prescribing physician to avoid medication errors. Consulting with a pharmacist is also acceptable, but it is best practice to clarify with the physician directly. 19. Which of the following is an example of a patient safety measure in a hospital setting? A. Allowing the patient to administer their own medication without supervision. B. Using bed rails to prevent falls in high-risk patients. C. Ignoring the patient's confusion due to medication. D. Avoiding communication with a healthcare team about changes in the patient's condition. Answer. B. Using bed rails to prevent falls in high-risk patients. Rationale. Using bed rails for patients at high risk for falls is a well-established patient safety measure. Ensuring proper communication and managing confusion are also important, but using bed rails specifically addresses fall risk. 20. In a situation where a nurse must make a clinical judgment quickly, what is the most effective way to prioritize care? A. Address the most comparable and least risky issue first. B. Focus on addressing the life-threatening concerns first. C. Handle all concerns simultaneously. D. Wait for further assessment by the physician. Answer. B. Focus on addressing the life-threatening concerns first. Rationale. In urgent situations, prioritizing life-threatening conditions is critical to patient survival. Non-life-threatening concerns should be addressed after immediate risks are mitigated. Waiting or handling everything at once is not effective. 21. When making clinical judgments, what is the primary role of a nurse in relation to a patient's family? A. To inform the family of the diagnosis directly. B. To ensure the family's preferences override clinical guidelines. C. To provide support and clear communication regarding care. D. To delegate communication to the physician. Answer. C. To provide support and clear communication regarding care. Rationale. The nurse's role includes providing emotional support to the family and ensuring they are informed about the patient's care, while still respecting the patient's confidentiality and preferences. The nurse should not delegate the family communications solely to the physician. 22. Which action is most important when a nurse is conducting an initial assessment of a patient? A. Taking a detailed history of the patient's illness. B. Ensuring the patient's vital signs are recorded. C. Establishing rapport and trust with the patient. D. Administering the required medications. Answer: C. Establishing rapport and trust with the patient. Rationale: establishing rapport and trust is crucial during the initial assessment to ensure that the patient feels comfortable and confident in sharing vital health information. While vital signs and history are also important, trust forms the foundation of effective care. 23. A nurse must decide between several patients requiring attention. Which is the most appropriate first step? A. Attend to the patient who demands attention first. B. Prioritize based on the severity of each patient's condition. C. Speak with a healthcare provider about the situation. D. Begin care with the patient who is most cooperative. Answer: B. Prioritize based on the severity of each patient's condition. Rationale: the nurse should prioritize care based on the severity of the patient's conditions. Critical and life-threatening situations should be addressed first. Cooperation or immediate demands should not override patient need. 24. In a patient with a history of seizures, which action should the nurse take when a seizure occurs? A. Try to restrain the patient to prevent injury. B. Monitor and document the duration and characteristics of the seizure. C. Immediately administer the prescribed sedative medication. D. Leave the patient alone to avoid interference. Answer: B. Monitor and document the duration and characteristics of the seizure. Rationale: during a seizure, the most important actions are to ensure the patient's safety by preventing injury, monitoring the duration and type of seizure, and documenting for clinical assessment. Restraint, sedatives, or leaving the patient are inappropriate and dangerous. 25. What is the first step a nurse should take when a patient exhibits signs of anaphylaxis after receiving medication? A. Administer antihistamines immediately. B. Assess the patient's vital signs and airway. C. Notify the healthcare provider. D. Give the patient fluids to flush out the medication. Answer: B. Assess the patient's vital signs and airway. Rationale: the first priority in anaphylaxis is to assess the patient's airway, breathing, and circulation to ensure they are stable before administering medications or fluids. 26. Which of the following best demonstrates the nurse's use of clinical judgment when caring for a patient with a new diagnosis of diabetes? A. Educating the patient solely on insulin administration. B. Collaborating with the healthcare team to develop a comprehensive care plan. C. Providing the patient with a generic care plan based on their diagnosis. D. Administering insulin based on the patient's blood glucose level. Answer: B. Collaborating with a healthcare team to develop a comprehensive care plan. Rationale: clinical judgment involves using a holistic approach, including collaboration with a healthcare team to develop a comprehensive care plan that addresses all aspects of diabetes management, including lifestyle changes and medication. 27. A nurse is planning care for a patient with a pressure ulcer. What is the most important consideration when developing the care plan? A. Ensuring that the ulcer is cleaned with antiseptic. B. Identifying and addressing the underlying cause of the ulcer. C. Using a wound dressing that is aesthetically pleasing. D. Scheduling daily wound assessments at a consistent time. Answer: B. Identifying and addressing the underlying cause of the ulcer. Rationale: the most important aspect of pressure ulcer care is addressing the underlying cause, such as immobility or malnutrition, to prevent further injury and promote healing. Wound cleaning and dressing are important, but secondary to addressing the cause. 28. When communicating with a patient, which of the following strategies should a nurse use to enhance clinical judgment? A. Use medical jargon to explain complex procedures. B. Encourage the patient to ask questions and express concerns. C. Speak in a condescending tone to ensure understanding. D. Avoid discussing diagnosis-related details to prevent patient anxiety. Answer: B. Encourage the patient to ask questions and express concerns. Rationale: Encouraging the patient to ask questions promotes understanding and helps the nurse gain insights into the patient's concerns, which enhances clinical judgment and the quality of care. Using medical jargon or avoiding discussions can hinder communication. 29. A nurse is caring for a terminally ill patient who has expressed a wish to stop all life-sustaining treatments. The nurse should A. Continue life-sustaining treatments until the family agrees. B. Honor the patient's wishes if they are legally competent. C. Withhold life-sustaining treatments and inform the physician. D. Ignore the patient's wishes and provide comfort measures only. Answer. B. Honor the patient's wishes if they are legally competent. Rationale. If the patient is legally competent, their wishes regarding treatment should be respected. This is a key element in clinical judgment, as it involves both ethical and legal considerations related to patient autonomy. 30. A nurse must decide whether to administer a prescribed medication to a patient with an allergy to that medication. What is the nurse's most appropriate response? A. Administer the medication and monitor for an allergic reaction. B. Contact the healthcare provider to clarify the medication order. C. Administer the medication and document the allergy in the chart. D. Ignore the allergy information and proceed with administration. Answer. B. Contact the healthcare provider to clarify the medication order. Rationale. The nurse should clarify the medication order with the healthcare provider, as administering a medication to which the patient is allergic can cause serious harm. Clarification ensures patient safety and prevents errors. 31. In a situation where a nurse must make a clinical judgment about prioritizing multiple care tasks, what is the most important factor to consider? A. The nurse's personal preferences for care tasks. B. The urgency and severity of each task's impact on patient outcomes. C. The time of day and the nurse's schedule. D. The resources available in the healthcare setting. Answer. B. The urgency and severity of each task's impact on patient outcomes. Rationale. Prioritizing care is based on the urgency and severity of patient needs. Critical tasks that affect patient survival and well-being should always be addressed first. Time of day, personal preferences, and resources are secondary. 32. A nurse is assessing a postoperative patient and notices a drop in oxygen saturation levels. What is the nurse's first action? A. Call for assistance from the healthcare provider. B. Administer oxygen and continue monitoring the patient. C. Perform deep breathing exercises with the patient. D. Document the change and reassess in 30 minutes. Answer. B. Administer oxygen and continue monitoring the patient. Rationale. The first action is to administer oxygen to stabilize the patient's condition and ensure adequate oxygenation. Calling for assistance and documenting can follow, but stabilizing the patient comes first. 33. A patient reports feeling anxious about an upcoming procedure. What is the best approach the nurse can take? A. Ignore the patient's anxiety and proceed with the procedure. B. Offer reassurance without explaining the procedure. C. Provide a detailed explanation of the procedure to reduce anxiety. D. Minimize the patient's concerns by saying, "Don't worry, everything will be fine." Answer. C. Provide a detailed explanation of the procedure to reduce anxiety. Rationale. Providing a detailed explanation of the procedure helps the patient feel more in control and reduces anxiety. Dismissing the concerns or providing vague reassurance may increase the patient's anxiety. 34. What is the most appropriate nursing action when a patient with a history of alcohol abuse presents with confusion and agitation? A. Administer sedatives to calm the patient. B. Immediately assess the patient for signs of alcohol withdrawal. C. Notify the healthcare provider for medication orders. D. Encourage the patient to drink water and rest. Answer. B. Immediately assess the patient for signs of alcohol withdrawal. Rationale. Patients with a history of alcohol abuse are at risk for withdrawal symptoms, which can be life-threatening. Early identification and intervention are crucial to prevent complications. 35. When making a decision about a patient's care plan, what is the nurse's responsibility regarding evidence-based practice? A. Always follow the most recent guidelines without question. B. Review the latest research and adapt care accordingly. C. Rely solely on physician orders for treatment decisions. D. Provide care based on the nurse's personal experience and intuition. Answer. B. Review the latest research and adapt care accordingly. Rationale. Evidence-based practice involves integrating the latest research with clinical expertise to provide the best possible care. Relying on outdated guidelines or intuition without considering evidence can compromise care quality. 36. What is the most important action when a nurse identifies a potential ethical dilemma in patient care? A. Ignore the dilemma and proceed with care as usual. B. Discuss the dilemma with the healthcare team and seek guidance. C. Make a decision based on personal beliefs. D. Act in a way that satisfies the patient's immediate request. Answer. B. Discuss the dilemma with the healthcare team and seek guidance. Rationale. Ethical dilemmas require careful consideration and discussion with the healthcare team to ensure that patient care aligns with ethical standards and best practices. 37. A nurse is caring for a patient in a critical condition. What is the nurse's first priority in clinical decision-making? A. Providing emotional support to the patient's family. B. Monitoring and stabilizing the patient's vital signs. C. Administering prescribed medications. D. Coordinating care with other healthcare providers. Answer. B. Monitoring and stabilizing the patient's vital signs. Rationale. The nurse's first priority in a critical situation is to stabilize the patient's condition by monitoring and addressing vital signs. Emotional support and coordination are important, but secondary to patient stabilization. 38. Which statement best describes the role of a nurse when working with patients from diverse cultural backgrounds? A. Provide care that reflects the nurse's own cultural values. B. Encourage patients to adopt the nurse's cultural practices. C. Offer culturally sensitive care that respects the patient's beliefs. D. Ignore cultural differences to maintain professional boundaries. Answer. C. Offer culturally sensitive care that respects the patient's beliefs. Rationale. The nurse's role is to provide care that respects and accommodates the patient's cultural values, which can impact treatment preferences and outcomes. Ignoring cultural differences may lead to misunderstandings or poor care. 39. When a nurse is assessing pain in a nonverbal patient, what is the most effective approach? A. Use a pain scale to evaluate pain intensity. B. Observe for nonverbal signs of distress, such as facial grimacing. C. Administer pain medication without assessing the patient. D. Ask the family to interpret the patient's pain level. Answer. B. Observe for nonverbal signs of distress, such as facial grimacing. Rationale. In nonverbal patients, the nurse should look for nonverbal cues such as facial expressions, body language, and physiological changes to assess pain. Relying solely on scales or family input may not capture the patient's true experience. 40. What is the primary consideration when determining whether a patient is ready for discharge? A. The patient's ability to manage their medications. B. The patient's understanding of their diagnosis and treatment plan. C. The patient's emotional readiness to leave the hospital. D. The availability of transportation for the patient. Answer. B. The patient's understanding of their diagnosis and treatment plan. Rationale. A key factor in readiness for discharge is ensuring the patient understands their diagnosis and treatment plan to manage their recovery effectively after leaving the hospital. Medication management and emotional readiness are also important, but secondary.